On a dark and stormy night, the monster of Dr. Frankenstein's creation lay peacefully sleeping on a hospital gurney, with electrodes placed on either side of his head. Dr. Frankenstein carefully stimulated the creature's brain with a brief controlled series of electrical pulses. These pulses induced seizures lasting about a minute each time, and the creature was getting treatment for his bipolar depression with electroconvulsive therapy. Hi everyone, and welcome back to the Aiden Therapy Services channel. I'm Emily, and today, in the spirit of Halloween and all things spooky, I wanted to talk to you all about what is ECT. So ECT is electroconvulsive therapy, or shock therapy as it's sometimes known. Now, immediately, I'm sure you all have an image of ECT from some movie or TV show, with One Flew Over the Cuckoo's Nest being one of the most famous depictions. The image that you have in your brain is more than likely barbaric and gruesome, and I'm sure has filled you with some apprehension around ECT. But perhaps today you're a little curious. So let's demystify. Now, for those of you who want to follow up on some of the resources or read them for yourself, I'll be including the list of the resources used in this video or to inform this video in the description below. ECT can be traced back to 1934, making it about 90 years in existence, when Dr. Laszlo or Ladislas, depending on your resource, Meduna, theorized that inducing a seizure may be helpful in treating psychiatric illness. Dr. Meduna's method involved injecting camphor and inducing a seizure chemically. While effective, it was inefficient, as it could take a few minutes for the seizure to begin, at which point would throw the patient into a state of pure panic and terror. Now, soon after Dr. Meduna's discovery, a team of Italian physicians led by Drs. Ugo Cerletti and Lucio Bini sought to derive a method to induce seizures electrically so it'd be quicker and have fewer side effects. In 1938, they conducted their first human trial with one individual afflicted with schizophrenia. After 11 treatments over the course of the individual's hospitalization, the treatment was deemed successful, as the individual's psychosis was reduced and the individual was able to return to his wife and a job in the community. Once news broke out about the success, ECT treatment spread, and the rest, they say, is history. But not quite. When ECT was first developed, and really for the first decade and a half or so, patients were awake and conscious during the procedure, and side effects were more pronounced. In preparing for this video, Becky and I did research, and we didn't find exactly how ubiquitous the use of ECT was throughout history. My guess is it was probably overused in the early days because, as has often occurred in history, whenever a new treatment comes onto the scene, it gets treated as a panacea, a cure-all for anything and everything. We've seen this with lobotomies, opiates, you name it, we've seen it. Certainly portrayals of ECT haven't helped with the fear and controversy surrounding ECT, which continues to linger. That has really stigmatized the treatment when it can actually be helpful, which I'll get to in a minute. Now, today, ECT looks much different. Yes, ECT is still a treatment that you can get today. It's not something that is gone days past. So, what makes it different? Well, for one, it is more regulated than it was previously, and there have been many more years of research. So the procedure is much safer than it was in 1938. Today, the person receiving ECT is under general anesthesia. Therefore, only hospitals can conduct ECT, or administer rather, ECT. This doesn't mean that every hospital is going to be conducting ECT. Offhand, in Colorado, I know I can confirm that at least 2 in the Denver metro area administer ECT, with the possibility of at least 2 more. But again, when you think of how many hospitals are in existence in a state, it's a small number. All right. Now, with what is an ETC session? Well, the sessions may last about an hour, which includes the recovery time, and the patients receive ECT approximately 2 or 3 times a week. Under general anesthesia, electrodes are attached, and then charge is done to give those electrical pulses to induce the seizure. All right. Total sessions will vary depending on how severe the patient's symptoms are. You know, like if, and this for a variety of reasons. All right. But generally, based on what we were able to find, it seems to be about 6 to 12 sessions, maybe a little bit more. Given the nature of the procedure, because you're going to be under general anesthesia, you know, there's going to be inducing of a seizure and whatnot, informed consent is a must, along with a complete medical history. Some of the side effects that can occur with ECT include confusion, which is temporary, some memory loss, which also appears to be temporary, nausea, and a headache. When might ECT be appropriate? So ECT may be an option for treatment-resistant depression, bipolar disorder, catatonia, which is basically a complete shutdown of functions. Think of a, quote, zombie-like state, though that's not what it is. The person's bodily functions are, you know, the person's still breathing and still has a pulse, but is completely unresponsive. Mania, severe psychosis, and schizophrenia. I said treatment resistant, so treatment resistant means the other forms of treatment, such as medication and therapy, are not working. The person is not getting better. In the research, an article from the Mayo Clinic also indicated that ECT may be used during pregnancy when other drugs may be contraindicated, in older adults who can't tolerate drug side effects, and when ECT has been successful in the past. So like if you were a person who's had ECT done and you're experiencing similar symptoms, maybe it might be something that can be tried again. Who shouldn't have ECT? Well, obviously, you know, before you go down the rabbit hole of like, hey, let's go get ECT, talk with your doctor, you know, because even if you're a little bit apprehensive but are willing to give it a try, your doctor can talk with you about like potential modifications that can still be successful but not, can still be successful and tailored to whatever health conditions you have. But we want to make sure that we talk about some of the health conditions that may be contraindications for ECT. These include a recent heart attack or unstable heart conditions that increase the pressure inside your skull, so like maybe a brain tumor, hydrocephaly, stuff like that. Recent strokes or aneurysms or brain bleeds, which, I mean, if we think about it, these make sense. And then severe lung diseases such as COPD and other life-threatening conditions. Because the complete medical history needs to be taken, of course, these would probably come up before you even get the administration of the ECT. A question that came up in preparing for this video is, what about adolescents and children? Now, I have yet to personally know anyone under the age of 18 who have had ECT, but it does appear it can be used with adolescents. Now, I don't know for the rest of the world, but in the US, it's more complicated. First of all, there are several US states that do not allow ECT to be administered to minors. Additionally, in states where it is legal to administer ECT to minors, it can be a complicated and complex process to obtain consent. In one of the Mayo Clinic articles that I read, in the state of Minnesota, as an example, besides the child psychiatrist of the adolescent, 2 other board-certified child psychiatrists must review the patient's record, interview the patient, and agree with the recommendation to treat with ECT before even proceeding to obtain parental consent. So before the parents give their say on yes or no, all that has to happen. So that can take some time. Bottom line, unless you are determined and really ready to go through the rigmarole and feel that it's going to be the best option for your teen, it's not going to be your go-to treatment. It's going to take some time to get that approved. Are there other options? Is ECT the end-all be-all? No, ECT is not the end-all be-all, and yes, there are other options. Remember, ECT is for treatment-resistant conditions, which means you have to try medication, psychotherapy, and sometimes other forms of treatment, unless it's an acute condition, meaning that the severity is short-lived but really strong in the moment. So, let's say you are at the point where meds and therapy aren't working anymore, but you don't want to jump on ECT. What are other options? So, there are other options, and two of the ones that seem to be the most popular after ECT are transcranial magnetic stimulation, or TMS, and vagus nerve stimulation, VNS. TMS involves the use of rapidly alternating magnetic fields to stimulate specific areas of the brain. In TMS, the patient remains awake and it does not cause a seizure, so it's an outpatient procedure and you don't have to check into the hospital. In fact, where I was previously located with my office, one of the other offices in the big suite happened to be a business that offered TMS. Vagus nerve stimulation involves using a device to stimulate the vagus nerve. So there are two. It's one of the big nerves in your body. And I'm not going to go too much into it. If you want to look up the vagus nerve, you certainly can. But just really briefly, what this device does is it's surgically implanted, though there are non-invasive stimulation devices that don't require surgery now. But basically what the device does, whether it's implanted or not, is it provides intermittent electrical stimulation to the vagus nerves in the neck. It can take months to develop sensitivity to the stimulation, so it's not considered a treatment for severe depression. All right. So now let's go back to our story. So after the creature underwent his course of treatment, he started to feel much better. He no longer stormed around the castle, breaking things as he went through his periods of extreme mood swings. Within the changes in his brain, he settled down and became a friend to the doctor who created and treated him. All right. Thank you so much for joining me today. I hope this provided at least a brief overview and some information around ECT and helps destigmatize this valid treatment that can help a lot of people. If you like this video, please leave a comment and a like. Again, this is Emily from Aiding Therapy Services, and remember, because we all need a little help sometimes. Be safe out there.